Hi friends, good morning, good afternoon or good evening, whatever may be the time you are seeing this video. It's lovely to see you through this video. There are a lot of ways to enjoy learning pathology. I'm explaining few of them here. I hope you will enjoy. Here we go. There are a lot of ways of make learning pathology fun, and let us see how to learn pathology with fun. Why it is important? Because if you want to be a very good pathologist, you have to read, and when you read, you can lead, because leaders are good readers. In this 40 minutes video, I just want to go through first facts in life before jumping into pathology. After analyzing the facts in life, please believe me, that will help you to make you more happy. Then we will concentrate on how to learn pathology with fun, how to approach the exam, and what to do after the exam. Coming to the facts, fun in our life, I just want to ask you, who is your boss? And the answer should be yourself. You are your boss. That understanding is very, very essential to keep yourself happy. To accept you as your boss, you have to know about yourself, you have to respect yourself, and you have to love yourself. You ask yourself, do I love me? You have to love yourself without any condition. And please believe me, if you follow these things, you will enjoy life at the most. The next question is, what do you want to achieve in life? Do you want to be the richest guy? Do you want to be the wisest guy? What is your goal in your life? And I think happiness should be the goal for everybody. Whatever we do, that should keep us very happy. That should be the thing we have to achieve in our life. Do you all know how to keep yourself happy in your life? You have to do what you love, and you have to love what you do. The otherwise, it is also known as passion. When you do things with passion, you will love doing it, and that will keep you very happy. We have to be very positive in our life. For that, we have to think positive. Then only you will get positive things. When you think positively, it creates an environment that will make you more happy. And when you are more happy, you can enjoy what you are doing. So think positive for positive things. Change is the only thing that won't change. But regarding change, there are two things you have to remember. One is accept what you cannot change. And the second one is change what you cannot accept. I will give you a small example. There are 24 hours per day. Do you all agree? Either it can be Bill Gates or it can be security of your apartment. The total hours per day are 24. Can you change it? You cannot change it. Just accept it. But how you are using that 24 hours? Are you sleeping for 20 hours? Are you reading for only 1 hour? Can you change it? Yes. So change what you cannot accept and accept what you cannot change. And finally, plan. We have to plan our life. In Western countries, they will ask you, what do you want to be in 5 years' time? That amount of planning is very, very important. And many people don't know, fail to plan is a plan to fail. So you should not be a failure model. Planning is very, very important. The summary of the facts in life: you are your boss. You have to love what you do and do what you love. You have to be positive. You have to change what you cannot accept, and you have to accept what you cannot change, and you have to plan your life. With those basic things in our mind, let us go to pathology, how to read and lead. The questions that will be answered here are what to read, where to read, when to read, and how to read. Let us go step by step. There are too many choices in answering those questions, and I don't want to leave you vaguely. At the end of this video, I want some concrete ideas in your mind. So I am giving my best choices with a disclaimer that I don't have any financial connection to any publishers, websites, editors, authors, or others. What to read? Let us see it first. In pathology, the minute you enter in training, there are various branches that you have to know a basic knowledge: surgical pathology, cytology, hematology, clinical pathology, transfusion medicine, autopsy, and others. The others depends upon time and your interest. For example, now molecular pathology is the hot cake. Tomorrow it can be artificial intelligence, but you have to keep yourself updated by seeing what is happening in that particular time period of your life. The first thing to become successful is to limit the reading material. Limiting the material is the mantra for satisfaction and success. For surgical pathology, I want you to read Ackerman and Susan Lester. Susan Lester is Bible of pathology. It tells what to do during grossing, during reporting, and in difficult situations. So you have to have both these books in your shelf or in your iPad. And whatever the books I am mentioning here, you have to buy the latest edition. For cytology, you have to read Diagnostic Principles and Clinical Correlates in Cytology by Edmund Sibas and Barbara Duckman. For hematology, you have to read Kathleen Forker's book. For clinical pathology, you all know Henry's Clinical Diagnosis Management by Lab Methods. For transfusion medicine, you have to have some basic knowledge as a MD pathologist. And this book is for transfusion medicine for the pathologists by Brian Costello. It's a very nice book. For autopsy, you have to read a book by Miller, and you have to know Father Roberts, Pathologic Basis of Disease. But don't start reading this one from the first day, because it's full of theory and you may not like reading theory in the first year. First year, it has to be more practical. I will tell you how to read. My sincere advice is stay with one book and from cover to cover of that book. Don't jump from one book to another. I did it in my life. I started with Ackerman, read one chapter, and then I took Sternberg. I read the same chapter in that. Because of the basic knowledge I gained in Ackerman, I loved that chapter in Sternberg. Then I read one chapter in Sternberg. With that basic knowledge, I read the same chapter in Ackerman. Ackerman looked better. So what I did, I closed both the books and stopped reading. This is what happened when you jump from book to book. Tell yourself, after finishing one book, I will take the next one. And another very important question is, whenever I tell these things to my students, they will ask, sir, is it enough? When can you ask that question? After finishing whatever is suggested to you. If you are done with all the material which I am going to tell now, then you come and ask me, I will tell what is the next book to read. Please remember, limiting your material is the way to success, and stay with one book for each division of pathology. Reading journals is very, very, very essential in the postgraduate period. And you have to read a couple of journals every month. What do you mean by reading? Don't be worried. It is humanly not possible to read all the journals. Just go through the contents of these journals. For example, AJSP and Advances in Anatomic Pathology, Archives of Pathology and Lab Medicine, Histopathology, and Seminars in Diagnostic Pathology. These are all for surgical pathology. For cytology, I have two journals, Diagnostic Cytology and Acta Cytologica. For hematology, it is Blood and Blood Reviews. And Journal of Clinical Pathology talks about all the clinical pathology advancements. So every month you just go through these contents of these journals and make a table. For example, this is May 2020. What are all the journals you looked into the contents of the journals? After finishing the contents, you see, are there any review articles? Are there any article that tells you how to approach a particular lesion? Read that article in full. All other original articles, you just read the abstract and keep yourself updated with the things happening currently in these areas. And when you are reading journals, you have to organize yourself. How do you know you are covering all these journals? It's not possible to type in all the journal web addresses every month. So keep them in your bookmark under the journals. These are all the journals I read, and all the web IDs are in my bookmark. So I just by clicking it, I will get into these journals. And I told you the review articles you have to read in full. And whenever you get a review article, you please arrange them in folders. This organization is very, very important. Whatever you are reading, a nice article, you have to pull it up when you need for practical use. So organization of reading journals is very essential. In these folders, you can keep it either in Dropbox or Google Drive so that you can open it wherever you go. Otherwise, if it is in your computer, when you need and when your computer is not with you, you will feel handicapped. So please leave it in a cloud. The thing I advise is Dropbox and Google Drive. Where to read? What is the place to read? You select a quiet place and table and chair. It's very, very important. Don't think you can read by lying on your bed and all. It won't work out. Please believe me. A table and chair in a quiet place is the first thing you need before you start reading. No distractions and no mobile phones when you are reading. Condition yourself to read. For example, when you are sitting in this chair, you have to read. If you come across anything, just get out of the chair, finish the thinking, and then come back to the chair. The minute you sit in that chair and the table, you have to read. Condition yourself. And the amount of concentration is like seeing a movie. Do you all understand? When you are seeing a movie, especially in climax, will you check your mobile? No. Like that much of concentration has to be there when you are reading. When you read 3 hours per day for 6 days a week, it is more than enough. Please believe me. And the hours also I am selecting and giving you. Read 7 to 9 p.m. in the night and 6 to 7 a.m. in the morning. 3 hours per day constantly. And Sunday is for you. Please do the things you love, your hobby, your sports, your arts. Coming to pathology doesn't mean end of our hobbies. You have to keep doing it and keep Sunday for yourself. Don't do anything that you don't like on the Sunday. What happens in real life? Everything we push it on Sunday. You want to do some homework, some seminar preparation, we will do it on Sunday. You have to read for the slide test, do it on Sunday. You have a big list on Sunday, and that's why every Sunday you feel miserable, and Monday you are having the fever. So please believe me, the postgraduates, my students, they love me because I tell them Sunday no reading. Sunday is for you. 6 p.m. from Saturday to 6 p.m. on Sunday, it is for you. You enjoy that time, provided you read 3 hours per day on all the other 6 days. So I told you what to read, where to read, and how to read. Remember, I told you 3 hours per day. 1 hour should be regular reading, 45 minutes of reading and 15 minutes of revision what you read. And 1 hour is for homework. As a postgraduates, you may have to do seminars, short topics, journal clubs. Please spend 1 hour per day to do the things which you have to carry out in the department, and 1 hour is for online media. This is very, very important. So let us see one by one. Regular reading. What do you mean by regular reading? Whatever happens on that particular day, you take Ackerman and read a chapter for 1 hour. What chapters you are supposed to read? That depends upon your daily work. For example, you are in a hospital where there are a lot of GI biopsies. You read the GI tract first. If you get more of endometrial curettings, read the chapter on uterus and endometrium. If you get too much of prostates, read the prostate first. I hope you all understand. Give priority to daily work when you are reading regularly, because whatever you read, if you apply during the reporting and during your regular time, you will remember them more. So regular reading depends upon the priority. Don't read Alzheimer's disease on the first day. You are not going to see any biopsies. When you take the textbooks, unfortunately, if you start reading from the first line in the textbook, you will close it in 5 minutes. Because, for example, for GI tract, they will start, it starts from the mouth, goes up to anal canal, esophagus measures 40 centimeters, stomach measures 20 centimeters, like that. We don't want to do that when we are starting pathology. We want to go for the gold. So get a condition. For example, when you are reading esophagus, directly go into reflex esophagitis. Go and read what is the gross findings of reflex esophagitis, what do you see microscopically, what is the differential diagnosis, and what special studies you will use to differentiate the list of conditions in the differential diagnosis. This will help you and stimulate you to read. If you read regularly from first line, you will close it. For example, reflex esophagitis, they will start with, it will happen both males and females, but it is more common in male, usually affect adults, but it has been reported in children. It is seen worldwide, but it is more in developed countries. Like that, all the data which are not of interest when you are starting. I'm not saying you don't have to read them. Here I want to stress one point. I take responsibility for whatever I am telling, but not what you are understanding. These two are different things. So when you read initially in the first year, anything, you go directly to a condition and start reading what is the gross, what is the microscopy, what is the differential diagnosis, and what is the special studies. And then you read the other things. And when you are reading in the first year itself, please get the university questions and write them chapter wise. For example, you are reading prostate. What are all the university questions asked in that prostate? It doesn't mean you have to read only the university questions, but you have to know what are all the questions asked in the previous year's university exams. So you can know what is the pattern of university questions for each chapter. I hope you all agree. If you disagree, if you have anything else to suggest, please leave it in the comment box. Pathologyoutlines.com is one of the best sites. Keep it with you. Whenever you want to read anything, any condition, after reading in the textbook, for example, see a prostate, after reading in Ackerman, go to Pathology Outlines and read what is given in CA prostate there. And they give very nicely all the journals, all the images, best images in the world for a particular condition. So keep the pathologyoutlines.com as your background supportive material. Online education. So we covered a regular reading. Homework you have to do depending upon what you are supposed to do. And let us concentrate on online education. Online education is getting more and more important now. And you have three main things there: virtual slide box, online videos, and Twitter. Let us see one by one. Before that, we are obtaining a lot of knowledge. And how do you retain the knowledge? Number one, they talk about memory places or things. For example, you are reading in a table, sitting there in the table. you are reading about H. pylori associated gastritis. Please attach the small tumbler there. See there, that small tumbler for H. pylori associated gastritis. So whatever you read, you try to recollect by seeing this tumbler. So whenever you see the tumbler, you need to remember the things you learned about H. pylori. So that means you attach certain things or places with the revised material of a particular topic, that will increase the time of retention of that particular knowledge. Spaced and well distributed learning. We have to understand we are all human beings. We can't remember just by reading one time. By spaced reading means every week you revise whatever you read in that week, and that will help you to keep things in your memory. The most powerful thing to retain whatever you gained is teaching somebody. Because when you teach somebody, you want to simplify the things. By simplifying, you will be simplified. So teaching is very, very essential to retain the knowledge you gain. So whenever you read something, you get your colleagues or juniors and teach them. And another most important thing you have to remember is read whatever you want to apply, and apply whatever you read in your daily day-to-day practice. Do many practice tests and attend MCQs. This is one of the best websites. You can click it. It will take you to that website that has lot of MCQs in pathology. So let us shift the gear and go to the virtual slides. I mentioned 4 sites here. The first one is rosaicollection.org. You all know this is Jan Rosai, one of the best pathologists of our lifetime. And we have to thank Dr. Rosai, USCAP, and the Leica, because they have put thousands of his slides as a virtual slides. They scanned it and kept it. The second site is cap.org. They have a case of the month. For every month, they put 1 or 2 cases, and they come up with a beautiful handout. So this will be the second site. Third site is a new one, pathpresenter.net. This is by Dr. Raj Singh, a dermatopathologist in New York. He is the main man behind this. This is one of the best sites for virtual slide. And the fourth one is Recut Club. Remember, whenever you see nice slide, you ask for recut. So they use that name and they put it as recutclub.com. They also have a very good collection of virtual slides. There are thousands of sites are available for virtual slides. But as I told in the beginning, I want to give you the best in my opinion. After finishing these sites, you go to any other site. And as I mentioned again and again, if you see any better site than this, please leave that in the comment box. Let us now see very briefly what is given in rosaicollection.org. I just typed that and I got this website. There are some featured cases, but they are with the diagnosis. So what you can do is you just click the hide the diagnosis. It will hide all the diagnosis. The best way I like is search the collection. Okay, and you see, go to seminars and slides. So these are all the slide seminars given by Dr. Jan Rosai. And let me click one of them, A Day with Dr. Ackerman. Dr. Ackerman is the mentor for Rosai. So let us see what happened with A Day with Ackerman. You click that and click search. It will take you all the cases that was discussed with Dr. Ackerman, possibly on that particular day. The best thing here is when you click the view slide, and this is the area of the whole slide image, and that will tell you which area you are in that. So you are in this red box. So when you want to move that red box here, you bring it here and you will bring the image here. And If you want to see it in high power, just click 4x, 5x, 10x. The speed of the internet is very important to get the nice images, and you can go up to 20x, and you can even digitally zoom down. Okay, see how nicely the slides are completely uh, scanned and kept for us. Here the diagnosis is done. When you want to know the diagnosis, you click the pick the view, and there you will get the diagnosis. You click the peak, it's a rhabdomyosarcoma is the diagnosis. And the other thing I want to stress is, see the document, see the PDF file. When you click the PDF file, you go to the notes. See how thoughtfully they have done all these things. It has all historical letters, who all attended the conference, everything is there. In addition to that, it tells about the case submitted by whom, what is the history, and what was the discussion at that time. And at that time, not that many ISCs are available. So this is one of the best site to read the best description on HNE. So I strongly recommend all of you to go to rosaicollection.org, and whatever I have shown you is only tip of the iceberg. You play with this site and you can learn a lot of things. You please go and see all the other sites. Because of the time constraint, I'm not visiting the other sites. Online videos. Again, many websites are available, but the best thing, 4 things are: one is Pathcast, other one is virtual lecture series started during this corona time by College of American Pathologists. For cytopathology, the American Society of Cytopathology has its own live online series that are archived. And virtual pathology grand rounds, that's another website that gives online videos. When you go to Pathcast and when you click the playlist, you will get all the, just let us see what's happening in the Pathcast. To approach the Pathcast, there are a lot of ways. I usually use YouTube. Just go to youtube.com and there you type in Pathcast. And when you click the Pathcast, it brings the home page in the YouTube about Pathcast. In that, you go to the playlist. In the playlist, you get all the topics: blood bank, neuropathology, COVID, bone and soft tissue pathology. Let us see the full playlist in GI Path. Wow, we got quite a number of videos. Okay, these are all by experts in their area. For example, here, iatrogenic GI tract lesions, some tough pills to swallow by Dr. Elizabeth Montgomery. I saw this, one of the beautiful lectures by Dr. Montgomery. You will love it. Again, because of time constraint, I'm not going to go through all the other 3 websites. Please, you go and see the online videos. These virtual slides and online videos, you see them every day at least for 1 hour. And you see them when you are feeling sleepy, when you are not able to concentrate, because they will stimulate you to learn. The last thing on the online material is Twitter. Please believe me, Twitter is teaching me lot of new things that I can hardly grasp by reading. And in the Twitter, you have to follow 4 people. Dr. Gerard Garner is the grandfather of social media. Dr. Sanjay Mahobatiya is the father of Twitter learning. Dr. Cameron Missa and Dr. Sarah, they are the 4 actively involved people in Twitter pathology reading. And whatever interesting thing happen in Twitter, these 4 people will help you to keep updated, because they always retweet the interesting things that happens in pathology world. So we are done with regular reading for your homework and online. In the online, you have to know what are all the sites you have to visit for virtual slides, what are all the sites for online videos, and what are all the things you have to follow in Twitter. Don't try to do everything in one single day. Do it every day. Please believe me, if you do it every day, in a year's time, you might have finished most of the things. But remember, Twitter is a growing world. There is no end of learning in Twitter. So coming back in the daytime, what are you doing in the departments? Reporting is the main thing that happens in the department. So our learning, we have to divide them in reporting learning, learning before reporting, and learning after reporting. Learning before reporting is very crucial because the active learning starts only at 4 p.m. Many people don't know before coming to pathology that they have to spend some extra hours every day in the evening because the slides are given at 4 p.m. and you have to screen the slides from 4 p.m. So you must be tired with the day's work. So you just freshen yourself, have a cup of coffee, have some music in the background, and start seeing the slides. People used to ask me how to see the slides sincerely. My only thing is treat all the cases as your kith and kin. For example, if it is your grandfather's biopsy, how will you handle? If you have that idea in your mind, you never make mistake. And you screen all the slides sincerely and do a complete workup. What do you mean by complete workup? Before seeing the slide, get the history. Read all the things given in the request form. We pathologists always tell or complain the clinicians are not giving the clinical details. But whenever they give the clinical details in the request form, most of us are not reading. Whenever it is required, check the radiology. For example, there is a soft tissue tumor. Check the radiology first. And then if you have a hospital information system, go and see what is the intraoperative findings. Go and see other lab findings. Get all the material that will help you to diagnose a condition correctly. So that's what I meant by complete workup. And then give a good description. 90% of the time, you get the diagnosis without any additional history or workup. But in 10% of cases, you need a complete workup. So first finish the easy 90% and then leave the slides. For example, first case is taking some time. Just leave that slide. Make a note of it in your notebook. Go to the next slide. Finish the easy slides first, and then we can come back to the difficult cases at the end where we can spend more time. So this is very crucial to have a good knowledge. The more the time you spend in the department before reporting, the more you will be getting during reporting. During reporting, help the consultant as much as possible. Give all the background data. For example, a gastric biopsy, to please tell them this patient had a previous biopsy. Radiologically, it showed a antral mass, but the previous biopsy was not diagnostic. That's why they have done the rebiopsy. That history is very essential. Whenever you have any doubts, you clarify your doubts with the consultant. And during reporting, it is more like a passive learning, but it is more like how much interest you are having, it will be reflected on you by the consultant. So here you help the consultant. The more the help you do to the consultant, the more the knowledge you will be gaining. Coming to after reporting, carry out all the instructions. Keep a notebook, write down what are all the instructions for the cases of the day, and you please order them on the computer or write them in the notebook. Get the previous instructions reported. Remember the DPERS, IHCs, histochemistries we have reported, they may be waiting in one area. It is your duty as a postgraduate to get them and get the consultant to report them. You have to chasing the consultants. There are 5 cases. Madam, there are 2 cases with DPERS available. Please come and report. You have to stay active. And then go back to the lab. After finishing all the things, go back to the lab and get some hands-on experience. It can be histopathology, it can be cytology, it can be hematology. Go to the lab, learn from the technologists. So whatever they are doing, see once, do one, and teach one. For example, you are in cytology lab, see how they are doing the pap stain, do yourself one time, get hold of your junior and you teach them how to do. When you do this thing, you won't forget, and that will be there for lifelong. Thesis, it's another very crucial thing, and here I am giving you a plan how to finish it in 25 months. Let us assume people are joining in 2020 June. You have to take 3 months, whatever maybe the time period you are joining. I'm giving the number of months here for each topic. You have to select the topic and get the ethics clearance in first 3 months. And I have a video to help you how to select a topic. This is more like a self-advertisement here, not like that. Many people, they don't know how to select a research topic. Please believe me. Please go and see that video, that will help you. So spend 3 months on that. The next 6 months, you start the literature collection, start selecting the cases and the blots. Spend 3 months to order the reagent and to standardize the tests. Run the test for the next 4 months. Interpretation of the tests for the 3 months to follow. Give the results to the statisticians, discuss with them, get the statistical significance of your work in 2 months. Then start writing the thesis for 3 months. And at the end of the 3rd month, give it for the correction. And allow the gate to go through for 1 month. And at the end of the 1 month after giving for correction, it should be ready. So if you add all these months, it will come up to 25 months. Please plan yourself. You may think it is 3 years, you have a lot of time. See, all these 3 years is in this box and it looks very crowded now. So planning is very important. Remember, fail to plan is a plan to fail. 6 months before exam, how to prepare for the exam. You have a lot of things on your table. And here I have a picture of the sponge and the brick. Why I have put this? These 6 months, your brain is like a sponge. Whatever you read, it will absorb. Even though I am telling how you have to prepare and all these things, during the first 2 years, your brain is like a brick. Whatever you read, it takes a lot of time to go in. But in the last 6 months, in no minute, you can understand all the things. Take 10 years of university questions of your institute and start focusing on them. Remember, this 6 months, our main aim is to clear the exam. Whereas in the other 2.5 years, to know the knowledge. Don't confuse. Gaining the knowledge is unfortunately different from passing the exam. Now you more read Robbins to know the theoretical knowledge, because you have a good amount of practical knowledge. Reading theory will enhance your theoretical and practical knowledge. Recent advances, 5 years. You know, each year there is we have one fascicle of recent advances. Read for 5 years. Remember the journals I mentioned. All the review articles from those journals for the past 2 years. Seeing the virtual slides and seeing the PG slide boxes will help you to enhance your practical knowledge. This is very essential, and you please do it in the afternoons when you don't have time for very active reading. So this will avoid you falling into sleep. Then you go through the components of the practical exam. Each university have their own components. You please see the components, write them down. For example, in our institute, we have autopsy, clinical pathology, pedagogy, in addition to histopathology, cytology, and hematology. So you read specifically for these components. In the exam, the day has come, D-Day. Please remember this joke. 2 years before exam in India, we read foreign authors. 1 year before exam, we start reading the Indian authors, textbooks written by Indian authors. And on the day of the exam, you are the author. Okay, so you have every liberty to write whatever you want. So exam is divided into written exam and practical exam. Let us first concentrate on the things you have to do it in the written exam. Read the question very carefully and plan how you want to write for 2 minutes. Answer all the questions. Please don't leave any question. If you write whatever you want, even if you don't know anything, you may get 1 or 2 marks. And those are all the marks that may help you to clear the exam. And write the questions in the numerical order. For example, if there are 1 to 10 questions, write 1, 2, 3, 4, 5, 6, 7, 8. Don't write question number 2 first, question number 8 next, question number 3, question number 9. So don't do the zigzag puzzle in writing. Write the questions in numerical order. Again, planning will help you. If you have essays, you have to write 6 pages and each page should have 20 lines per page. If you have to write short notes, it has to be 3 pages, again 20 lines per page, and all your answer should have subheadings, paragraphs, diagrams, tables, flowcharts. These are all the things must. That's why you have to plan how to write. Please have mercy on the examiner. I used to tell, whenever you are praying, you know, you all go to the temple before exam and we all pray. When you are praying for you, please pray for the examiner also. Coming to the practical exam, be confident and have a positive body language. That is very, very important. We think communication is mainly through verbal, with words. But please believe me, only 30% is by words, 70% is with your body language. So please have a positive body language. That means straight shoulders, looking straight, looking at the eyes of the examiners, but don't stare at them. Looking at the eyes give confidence in you and you can answer the questions better. Answer all the questions sincerely. If you don't follow the question, please tell them they don't mind repeating the question. And if you don't know the answer, please tell them that you don't know the answer. In practical exam, in all the experiments, please read the history for the cases. Systematic approach for the slide is very important. First, see the slide grossly and then with the low power and then with the high power. We will come back how to see the slides again in a minute. Screen the whole slide even outside the cover slip, especially in hematology and cytology. You will be surprised some microfile area will be lying outside the cover slip. Regarding your thesis, please know the summary, limitations and future directions because they will ask you in your viva. Even though the practical exam has many components, slides are the showstoppers. That means performance of the slides decides whether you clear the exam or not. In the slides, you have histopathology, hematology, and cytology slides. So how to approach these slides? You have to do 9 things. First, read the history and see the slide grossly. Looking at the slide grossly is very, very essential. It will tell you whether it is a tubular organ like appendix, fallopian tube, ureters. In biopsies, how many biopsies are there, how many levels are there, because you have to see all the levels. Please believe me, signet cell carcinoma may be in only one level of the biopsy. You have to see it to get the diagnosis. Is normal organ seen in the slide under the low power microscope? What is the pattern? For example, is it a glandular pattern, papillary pattern, nesting pattern, cribriform pattern, fascicular pattern? What is the pattern the tumor cells are arranged? Is it a neoplastic or non-neoplastic condition? Is it benign or malignant when it is neoplastic? When it is malignant, is it primary or secondary? These are all the questions you have to keep asking in your mind. What is the origin of the tumor? Is it from the epithelium? Is it from the stroma? Is it from the melanocyte? Is it from the germ cell? Is it from the mesothelial cells? You have to keep asking what is the origin of the tumor. And after going through all these 8 questions, write a good description. It's like writing a story. Start with the history, what is seen in the low power, what is seen in the mid power, and what is seen in the high power under the microscope. That will bring you to a diagnosis. If a single diagnosis is not possible, give a reasonable differential diagnosis. You cannot write lipoma and liposarcoma as a differential diagnosis. Okay, you can write atypical lipoma or liposarcoma can come in the differential diagnosis. And whenever you are writing a differential diagnosis, what are all the additional things you have to remember or you have to do? For example, small blue cell tumors. What are all the markers you want to do to come to a diagnosis? Make a note of it at the end of your differential diagnosis. Please don't get stressed out. Do your best and forget the rest, because the performance will go down when you get tensed up. If you follow all these things, you will become very successful learning pathology and in clearing the exam. So the last part of this video is what to do as a faculty. The reading should continue. People used to say the real exam starts after getting the degree. Learning is lifelong. Otherwise, life will not be long for you and for your patients. Read 1 hour per day. Remember, during PG period, you are reading 3 hours per day. But after clearing the exam, you have to read 1 hour per day. Again, it is 6 days a week. Sunday is your day. Develop subspecialty interest. That is the future of pathology. How do you develop subspecialty interest? Sit with the clinicians of the area which you like. For example, if you like GI pathology, sit with the medical and the surgical gastroenterologists. Discuss with them. Just have a friendly chat. Or you can do fellowships. Now in India, we have a lot of options in selecting the fellowship. Or you continue your medical education by attending online courses, by webinars, by attending the conferences. Develop a subspecialty interest. It's very, very important. And do active research in the area of your interest. And that research should be clinically driven. Apply for grants. If you are in a university setup, you have to have interest in research and you have to apply for grants. Publications is another very crucial thing that you have to do as a faculty to share your ideas to peers. And please believe me, case study doesn't have any value. You have to do case series or some bedside research that takes you to bedside. And to stimulate writing for publication, you keep writing something at least 2 hours per week in addition to reading for 1 hour. You keep writing something. Another small self-advertisement. I have a small video telling you how to write that will help you to stimulate you to write. Please believe me, a person who is learning continuously is better than a learned person. So to conclude, 6 points you have to remember. Love what you do and do what you love. Be the happiest person in the world. It is in your hand. Learn with positive enthusiasm because you should be loving to learn. Teach whenever possible because that helps you to retain whatever you gain. Attend the exam confidently. Don't worry about the result. Be a student for lifelong because learning is lifelong. When you do all these things with joy, you will enjoy learning pathology. And when you enjoy, it is enjoy to me. In Tamil, N means mine. It is joy for me when you enjoy. Thank you very much and have a great day. As usual, any comments, any suggestions, any points for improvement, please leave it in the comment area.